Hi, my name is Dara Stoianovici. I've been asked today to make a video about myself, about applied behavior analysis therapy, which is also called ABA, about autism, and about how a session looks like. So, as I said, my name is Dara. Thank you for watching my video. I have been an ABA therapist for 4 years now. I've worked in various settings such as hospitals, mainstream schools, special needs schools, clinics such as like therapy clinics, and also online therapy. I've also worked with children from various backgrounds such as UK, India, France, and Romania. My therapy sessions are tailored to the child's needs, and they usually include sensory therapy, speech and language therapy, occupational therapy, imaginative play, and also self-help skills. I'm also happy to help parents understand challenging behavior and manage behavior in a more efficient way. If you would have to think how is life for a person who suffers from autism, you would have to imagine that it's so frustrating not being able to express your feelings and your thoughts sometimes. So this can also give you a glimpse on how an autistic child feels. Autism, as you might know, is a lifelong developmental disability that affects how people perceive the world and interact with others. Autism is much more common than most people think. Actually, about 1 in 100 children in the UK and India under the age of 10 has autism. Okay. So people from all nationalities and cultural, religious, social backgrounds can be autistic, although it appears to affect more men than women. All autistic people have certain difficulties, but being autistic will affect them in different ways. And that means that they have different levels of support or care they might need. But some autistic people also have, for example, learning disabilities or mental health issues or even other conditions. Okay, so we need to be understanding and not label everyone in the same way. The characteristics of autism vary from one person to another, but in order for a diagnosis to be made, a person will usually be assessed as having, for example, persistent difficulties with social communications, social interaction. Some autistic people benefit from using, for example, alternative means of communication. So they might use sign language or visual symbols like PACS, Macatron. Other characteristics might be, for example, repetitive patterns of behaviors, sensory sensibility, repetitive activities, or even interests in the early childhood. Interventions based on ABA, so applied behavior analysis therapy, are considered to be effective in individuals with autism spectrum disorder. A therapy session usually focuses on breaking the task, using reinforcement, so something a child might prefer more, to assist in acquisition of new skills. But ABA also looks at understanding the function of behavior. So for example, a child might express a certain behavior to communicate something to you, or for attention seeking, or for avoiding a particular task. So it's important to break down and understand behavior. Also, research has shown that ABA is very effective in reducing disruptive behavior, which means, for example, self-injury or tantrums, non-compliance or self-stimulation. ABA has also been shown to be effective in teaching commonly deficient skills such as communication, social play, academic and self-help skills. The research is very clear that children who have received more hours of quality behavior intervention have better outcomes. An Australian review has recently recommended that children with autism should have a minimum 20 hours of intervention per week. But overall, other research have suggested that they should have between 20 and 40 hours a week, and this will be more effective. If you are asking now how long is an ABA session, it's actually between 2 hours and 3 hours, but it also includes a break, such as, for example, snacks or doing a preferred activity, so it can be not as tiring as you would imagine. But as I've just mentioned before, it's really effective. The earliest we intervene, the better, and we can look closely together. Hey, we are here to support your child's needs. I'm here to listen, and I look forward to hear from you. Thank you for watching the video.